welcome to a special edition of Medicine of Meadville. I'm Dwayne Kohler from Meadville Medical Center. And Obamacare has been around now for a number of years, and folks are, in some cases, getting coverage for the first time. And there's some confusion out there. We're hearing about that. So we've got an expert here to talk about that today, Lynn Shilling. Let me ask you, Lynn, to introduce yourself, your department.
Okay, I'm Lynn Shilling, and I'm the manager of Patient Access Services here at Meadville Medical Center. And in layman's terms, it's registration and admissions. We help any patient coming in to get registered for their services, and part of our responsibility is helping them get the right insurance on their account.
One thing that you shared this with me here several weeks ago, and this is a really helpful little resource. Talk about this for a second. Where did it come from, and where would somebody get a hold of this?
Sure. This is a pamphlet that was put out, and I actually received a copy of it last fall when I went to the Healthcare Literacy Council of Western Pennsylvania. And this is available to anyone who would like one. We have some here at the hospital. We will also, our hospital is going to be designing their form of a book very similar to this as well. But this book can be picked up in registration at any registration area within the hospital. We can make sure they have them available to anyone. From
coverage to care. I like the title, a roadmap for better care and a healthier you. So, okay, so I've got insurance coverage for the first time in my life. I'm all set. Don't have to worry about another thing. Is that right?
That's not right.
Okay. Explain.
All right. There's a lot that goes with insurance. The one most advantage that you would have as a consumer with an insurance card is on the back of your card is an 800 number, and that's your connection to the insurance company. When you have questions, you call that number and they answer any question. There are many terms and ideas that you may not be aware of as far as, is your service going to be covered by your insurance? You assume it is, but we want you to call your insurance company and verify that. When you come to the hospital, we will verify that you have that coverage, but perhaps the service you're coming for is not part of your plan. And that is something you would want to ask your insurance company prior to coming to the hospital.
Let me ask you one little twist on that. I hear a lot about UPMC. I hear a lot about Highmark, and there's network, and there's in-network and out-of-network. Explain that for a sec.
All right. In-network and out-of-network is very important. A network is actually a contract between a provider or a facility, which is the hospital or the doctor, and the insurance company. Meadville Medical Center has a contract with most insurances. However, not all insurance chooses to contract with the hospital. So if you are in network, that means your plan will be paid at the full benefit amount that the insurance company has for you. If you are out of network, you're going to have a higher cost out of pocket than the in-network. So it's very important before you come to make that call on the back of your card, your 800 number, and say, is Meadville Medical Center in network with my plan? That will give you a great start.
So if it's like a 70, 90-70 or something like that, so that means if I'm going to an in-network, so let's say I'm covered by a UPMC hospital, then I'm going to be covered at 90% of what that cost would be if I go there. If I opt to go someplace else, I'm going to be covered at that lower percentage, right?
That's correct.
And I'm obliged to pay that difference no matter what. Let me ask you a complication of that one. What about a deductible and a copay? And talk about that for a second.
Sure. And each insurance plan typically will have copays, they will have coinsurance, and they will have deductibles. Copay is an amount set by the insurance company stating perhaps if you come for a visit, the type of service you have has a $250 copay. That means you will be expected to pay that copay at time of service, and that is an amount that your insurance company has stated they already will not pay. So you will be responsible for a copay. A deductible is more of an annual type of fee, and you may have a $1,000 deductible as an example.
So even if the service is fully covered by my plan, I've still got to pay the first $1,000, and then the plan pays dollar number 1001, and then picks it up and goes forward from there, right?
That is correct.
Okay.
And there's also the coinsurance is an amount that even though you are in network, your insurance company may say, well, they have a 10% coinsurance, which means once you've had your service and it's billed, you will still owe an additional 10%. Not all in-network policies state that. Some will, some won't. Another one you have to consider is out-of-pocket expenses. And most insurance companies have a cap for out-of-pocket. And what that says is if your out-of-pocket is $2,000 and you've paid your $1,000 deductible, any other incidental expenses you may have out-of-pocket up to $2,000 will be your responsibility. After $2,000, then your insurance company is going to pick up the whole balance.
So even co-insurances and co-pays and all those kind of things are covered once I get that.
Once you get to your out-of-pocket.
And that's usually an annual
That's
thing?
an annual out-of-pocket,
okay.
Yes.
So now this is kind of complicated. Now, is there somebody that I could sort of check in with to make sure I'm not dropping the ball anywhere here?
Absolutely. The hospital has a couple different avenues you can take. First, we have financial counselors on staff, and we do have 3 at this time. And they would be more than happy to answer any questions about your policy, about your plan, help you understand it, give you some direction, help you, empower you to call your insurance company so that you completely understand your process. So we do have, like I say, 3 counselors available at the hospital to help you navigate through this.
Now, let me ask you another little twist here that I hear from folks from time to time, and it causes other confusion. I need to be pre-authorized or pre-certified or whatever to have that test or to have that surgery or whatever. Talk about that for a second. What's involved there?
Sure. Pre-authorization and pre-certification are very, very similar, and they are becoming more and more prevalent as we go through with this insurance. Insurances are changing. They're certainly not easy. They can be complex to understand. But a pre-authorization, definitely, if you're coming in for typically a scheduled test, could be a CAT scan, MRI, just as a couple examples, you would want to call your insurance company to make sure that they are authorizing this care. And what they're doing, the insurance company is authorizing that this is medically necessary to do this test.
Let me ask you to define that term. I'm going to stop right there. It's medically necessary.
Yes. In the eyes of the insurance company, has the physician or whomever's ordering the test done everything they can to treat you prior to maybe ordering a CAT scan? Have you had a basic x-ray? They may want to look at that information. It would depend on, the acuity of the care that's needed or the type of testing that's needed.
Okay, so medically necessary means I'm not going to get, so I'm the doctor or the hospital, I'm not going to get paid better if I do this test on you, so that's it's not medically necessary. Medically necessary means it's in your interest, patient, right?
Yes.
Am I saying that right?
Yes.
Okay. Okay, so go on with the authorization. I'm sorry I interrupted.
That's all right. And the authorization is what the insurance company, the physician office will call your insurance company after you've had an appointment with them, and they say, I think you need an MRI of your knee. The doctor's office will then call the insurance company and give them the details and why they feel you need this. And the insurance provider will say, okay, and they will give them a number, and that goes on your account.
So let's step back from that for a second. Let's say I'm having a problem with my knee.
Okay.
And it's like, well, okay, maybe I sprained my knee, and an x-ray will figure out that, yep, nothing's broken or whatever. But no, so weeks go by, and it's still hurting. And so CAT scans are more expensive than an x-ray, so we better get a CAT scan and see. And that doesn't show anything. We better get an MRI and see. So the insurance company's like, we've already paid for a bunch of things. What's going on here? So, I mean, there is a kind of a logical progression in your medical interest to sort this out. It's not it's not getting better from a minor thing, and so we're going to look. Am I making
You're correct
the right
in
path
that.
here?
Yes, they want to start out, like they say, the basic x-ray, and then if it's still not progressing the healing of your body the way it needs to be, then they need to do more invasive testing. But each of the next type of test will require another pre-authorization from the insurance company, stating that they will consider paying for this service.
To take my sore knee one step further, okay, I limp into the doctor's office and my knee's hurt. Okay, we're going to take you to surgery right this minute. So that's not going to work, right? I mean, we got to go through those steps first to make sure that we actually have something that's going to be fixed by a surgery, because that's invading me. That's going to put me at risk for some other problems or whatever. We want to go through all those other steps first.
We do, and that was a good example, because if you're limping into your doctor's office and you are in pain, and that is one thing, and yes, it probably won't happen right that moment, but it brings up a good point, Dwayne, that if you are in so much pain that you need emergency services, insurance companies do not require a pre-authorization or pre-certification for an emergency visit. if it is that extreme. But if it is where you can handle this with a physician office, that is definitely the best way to go.
One other thing too, if someone comes to the Meadville Medical Center, or any hospital for that matter, the hospital is going to see them, no matter what. It may not be the perfect spot for you. They may recommend you to another place, but they're not going to turn you away. They're going to see you.
That's correct.
That's in everybody's best interest to go that way.
Absolutely.
Okay, so let's kind of put a big summary on this whole thing. So if you were explaining this to somebody in 2 minutes, do you have a 2-minute speech, that you could sort of
well,
help people make sense of all this?
Sure, I can try that.
Okay.
If I had a 2-minute speech, I would just start out saying, Meadville Medical Center is here to care for you as the patient. We want you to be healthy. We want you to feel well. We, at the same time, also want you to understand that we are a sole community hospital, and we want to remain that way. And for those purposes, we need to protect our hospital as well as help you. And that's where the fine balance comes in. We need you as a patient to be responsible. When you come to the hospital, bring a photo ID and your insurance card. That way we make sure we have the right insurance on your account to start with. If you come after you've come for your visit to the hospital or the physician and they order you some testing, call your insurance company, the 800 number on the back of your card. Make sure this service is going to be covered. Are they going to pre-authorize it for you? Do they have any questions for you that you could bring back to us? Those are great starts. Where do we want to go from there?
Let me ask you a question, because this came up with a family member just recently.
Sure.
Had to go out of town because there was a specialty that didn't exist here.
Right.
And a family member asked me, do you think we should call? I said, yeah, what the heck? Why don't you call? Oh, I'm glad you called. That saved a bunch of hassle after the fact, because this would have gone as an out-of-network. And, and so that does make sense to make that call, even if you're not sure or you just want to clarify. Does that... Am I on the right page there?
You are. It is always best to call, especially if there is a specialist that maybe Meadville Medical Center doesn't have on staff, that you need to go out of town, whether it be to Erie or Pittsburgh, Buffalo, some of the places that folks from this community will go. Absolutely. Call your insurance company. Say, this isn't available at Meadville. I need to go elsewhere. And the insurance company will work with you. They will help you understand. Can they help you with higher coverage or not? That I don't know. That is only what the insurance company will tell the patient.
Another personal question. I think my plan has a copay of $100 if I have to go to the ER.
Yes.
Unless I get admitted to the hospital, then that's waived.
That's waived.
So when I come and I'm getting stitched up, or I'm getting my sore knee looked at, or whatever it happens to be, do I need to bring my checkbook? Can I use a credit card? Can I use a debit card? Are there other ways? I usually don't carry $100 worth of cash with me. So.
Well, not everyone does, but there are those folks that do. However, yes, when you come to our emergency room, it is beneficial if you have we take a credit card, we will take cash, we will take check, debit card. Those are all ways to pay for your services. And we do ask for your copay at time of service in the emergency room. We are also starting to ask for your copay at point of service, which means when you're coming in for that CAT scan or MRI, there will be a registration staff available to take your copay on that date of service.
Okay, so think ahead. Think ahead.
Be prepared to come.
Okay. Any other little tips from this book that we should sort of throw out there? I was very impressed. This was very helpful.
It is a very easy read. It gives you a real basic understanding, like it says, from care to coverage. Excellent booklet, and we do have those available for anyone who would like one. And
I noticed one thing that we talk about an awful lot is have a family doctor, check in with the family. This mentions this is all about your health,
right?
And understanding insurance is a big part of your health, and getting preventative care is a big part of your health, and that whole big picture. I really like this thing. So
it is. It takes you right from the beginning of taking health into your own hands. Being responsible for the wellness of your own body and your families, and finding a provider. And a provider would be like a family care doctor, called your primary care physician now. And talking with them, have a good relationship, and they can help you navigate through the process of wellness. And this booklet is very good. It takes you from there all the way through to where once you have insurance coverage, once the claim is paid, you will get an EOB, which is an explanation of benefits. And in this booklet, it also tells you how to understand that EOB, what it's saying, how much was applied to your account? How much is your patient responsibility? This booklet explains a lot in detail for that.
I've looked at some of those EOB things that you mentioned before, and one thing that tends to even confuse me a little bit is, okay, let's say the bill for the X-ray was $100, and the insurance company says, okay, we're paying $75, and now am I stuck for the other 20? Assuming I've already paid my deductible or copay or whatever, am I stuck for the other 25? How does that work?
It will depend. Actually, the hospital as a business has contracts with every insurance company. So we pay our part, the insurance company says they will pay this dollar amount, and if there is still a balance at the end of $25, which would probably either be your deductible or an out-of-pocket expense.
Okay, fair enough.
Okay.
Well, Lynn, thank you. That was very helpful. We appreciate you being with us on Medicine in Meadville. Okay, we have a health tip for you today. Stay tuned.
Hi, I'm Jamie Ferry, and I'm the Prevention Supervisor at Crawford County Drug and Alcohol, and I have your health tip. I'd like to talk to you a little bit about your prescription medications. A lot of people don't realize what all goes into being considered when a prescription medication is prescribed for you. And because of the variety of factors that are taken into consideration, you want to make sure that you utilize that medication and only you use that medication. And you want to use it appropriately. So you need to follow the directions on the bottle as it is prescribed. If it says that you're supposed to take one every 6 hours, then you take one every 6 hours. If that medication is not working for you and you feel like you need a stronger medication, then you need to talk to your physician about it and not change that prescription for yourself. Be aware that medications can have a lot of different side effects, and you're going to want to read your materials from the pharmacy when you pick up your medication, and you're going to want to check your medication before you leave the pharmacy to make sure that you have the medication that you're supposed to have, that it's the right dosage, and that it says the correct instructions that you understand you were supposed to have from your physician when you originally received it. You don't want to share your prescription medications. You may not be aware of a medical condition that someone else has that would affect them if they took the medication that you're on. If you believe that this is a medication that treats whatever the symptoms are well, you can certainly advise people that it's been successful for you, but they need to go through their physician in order to receive that medication. And you never just flush medications down the toilet or wash them down the sink. There are many ways that we can dispose of medications now, including prescription drop boxes and take-back events. If you are not sure how to dispose of it, talk to your local pharmacy, or we would be happy at the Drug and Alcohol Office to advise you on how to do that. So thank you for listening, and that was your health tip for today.